Imagine a sudden, alarming sight that can truly stop you in your tracks. When you vomit, and there's blood mixed in, it is a clear signal from your body that something serious needs attention. It is natural to feel worried and unsure about what to do next, but understanding the potential causes can help you act quickly and appropriately. Blood in your vomit, medically known as hematemesis, is an urgent symptom that always requires immediate medical evaluation. It signifies bleeding somewhere in your upper gastrointestinal tract, which includes your esophagus, stomach, and the first part of your small intestine, called the duodenum. This is a situation where prompt professional medical attention is absolutely critical to determine the source and severity of the bleeding. The why behind this alarming symptom typically involves damage to the lining or blood vessels within the upper digestive system. One common cause is a bleeding peptic ulcer, which is an open sore in the stomach or duodenal lining, often due to infection with Helicobacter pylori bacteria or prolonged use of certain pain relievers like non-steroidal anti-inflammatory drugs. Another significant cause can be esophageal varices, which are enlarged veins in the esophagus that rupture and bleed, usually seen in people with severe liver disease. Less common but still serious reasons include a Mallory-Weiss tear, which is a tear in the esophageal lining often caused by violent or prolonged vomiting or severe inflammation of the esophagus, known as esophagitis. Knowing what to look for can provide important clues for medical professionals. Vomit containing bright red blood usually suggests fresh, active bleeding, often from higher up in the digestive tract. If the blood appears dark brown and granular, resembling coffee grounds, this indicates that the blood has been exposed to stomach acid for some time. It is also possible, though less common, for blood from a severe nosebleed or a mouth injury to be swallowed and then vomited. Regardless of the appearance, any amount of blood in your vomit warrants a trip to the emergency room. When facing this situation, remember that your gut is a complex system, and any sign of internal bleeding must be thoroughly investigated. Doctors will typically perform an endoscopy, a procedure where a thin, flexible tube with a camera is passed down the throat to visualize the upper digestive tract and identify the bleeding source. This precise diagnostic tool helps guide treatment, which could range from medication to stop the bleeding, to endoscopic procedures, or in rare cases, surgery. Understanding these possibilities empowers you to communicate effectively with medical staff and advocate for your health. In essence, blood in your vomit is your body's urgent call for help, signaling a potentially serious issue in your upper digestive system. Recognizing this symptom and understanding its possible origins allows you to prioritize immediate medical attention, leading to a timely diagnosis and the necessary treatment to protect your overall gut health and well-being. Do not delay seeking care for this critical symptom.